Welcome back. For those of us who don't have 20/20 vision, glasses and contacts can definitely get in the way of many daily activities. And eye surgery is not for everyone, especially the kiddos. But what if you could wear corrective lenses while you sleep to improve your overall vision? Joining me now via Skype is optometrist Dr. Albert Peng. Dr. Peng, thanks so much for making time for us today.
Thanks for having me this evening.
Absolutely. So, Doctor, corrective lenses have come a long way over the last few decades, and you've actually taken it another step forward with a new treatment called orthokeratology. What exactly is ortho-K, and how does it work?
Actually, it's been a technology that's been around for about 10, 15 years. And what it does is, it actually look like a contact lenses, but you put the lenses on at nighttime, and because the shape of the lenses are made in a way that they're able to put pressure through the tear at the center part of the eye, flatten it, so that when you wake up in the morning, when you remove the lenses, you're able to see 20/20 by modifying the shape of the eye. Similar to LASIK, but without doing any permanent removal of any tissue.
Wow. Now, what are some of the pitfalls or cons to this type of treatment? Is it painful?
The comfort-wise is not anything more than just wearing the regular contact lenses. The only thing that sometimes people worry about is, say, when you're 6 years old, 7 years old, usually they don't have the skill to put the lenses in properly. So when they're too young, the parents will have to put the lenses in and remove the lenses.
Okay.
Again, of course, you also have to. The parents, if the patients are too young, the parents have to clean the lenses for them as well.
Right, because of the risk of infection.
Right, correct.
And that goes to say with any corrective lenses, anytime you're putting something in your eye, there is that risk.
Yes, correct. But of course, because we tend to put this type of lenses early on when they're starting to have nearsightedness, the reason is because this type of lenses has proven that you're able to slow down the progressions of the nearsightedness. So, say, for example, the parents have a high prescription wearing thick glasses. If you use this type of lenses, you're able to slow down the progression instead of going into the same consequence or same prescription like parents. They were able to have a much lower prescription.
Wow. Now, how long does it take to correct nearsightedness with this treatment?
It depends on the prescription. If I have a low or moderate prescription, I expect that the lenses were able to change the shape of the eye maybe in 1 day, 2 days, down to 20/20. But again, if you have a moderate to high prescription, then you should take about 5 to 7 days, 5 to 7 nights for you to change the shape of the eye so that you can see 20/20.
Okay. Now, is this treatment for everyone? You know, you talked about doing it for children, but is this something anyone could do?
Most people can use this, can benefit from this procedure. The only thing is, of course, if you have certain kind of corneal diseases, such as if you have a corneal scar, or if you have, some patients have a herpes infection to the cornea, or some genetic condition of corneal dystrophy, then we cannot use this type of lenses. But I would say 90% of the time we were able to use this type of lenses to correct it.
Wow, that's incredible and very exciting. Well, we're actually about to run out of time now, but where can we go for some more information or even to set up an appointment?
You can just go to our website, and that is trinityeyeCare.com, or you can just give us a call. And again, if you are not close to my office, you can also, Google, search for orthokeratology, and you're able to find places that can visit you.
All right, Dr. Peng, thanks so much for joining us today.
All right.